dog, you can't stroke a day.
Stroke simply means dying nerves.
Dying nerves.
Yes.
I bet you more.
Ahojojo intina ewu mani pedua na jojo. Na stroke no ombakeke.
Okay.
Ansa obehu so bi anya stroke no na kire say enwuma bi akoso ni pedua ni mu a akofo hawaba. Now one of the main causes of stroke may yi miensa.
Okay.
Bako eye cholesterol. Bako eye clogged blood moja de da wontin nim. And na bako say lack of vitamin B12.
Okay.
Good. Eye more on and on and on. Even chronic stress.
Okay.
Ono so kofa stroke ba. And as be person may dwell on the three that I mentioned.
Okay.
Wahuno onyankopon boy no or the distributor bi to nipa mu a ye frɛ no koma na sa koma yi eya issue ade bi e wo se nipa bone ho ban pa
akoma dey mu
yes
ohia attention sir
ohia on say nyako no de ko hye mfimfin
okay
that means from on sa uti wo kon wo yam kyese onye well protected so what you say se bibi koka no ho na ubehu se enwuma nipa de gu yam a yanwe ne ho sade ekom yam yi kofo ohaw ne sunsunso boni bi abadache eno ene ko ha koma no na ubehu se eating of too much meat cheese and a pizza too much salt and white sugar san nyoma ni nyina kofa ade e fe stroke eba e che say e ma wo build the excess cholesterol in fact ni pedua no a day no wo hia 200 milligram deciliter of cholesterol you understand to say bottle ensuo wom ya ye ensurudu a e wo say tumi kosa bottle nim it is a wood insuo gum exceeding sal limit na insuo aka ne bekoin ebegu fom eti koma no nyankopon ye say a day no e wo say mrebo no ono e manufacturer of cholesterol no otumi ma nipadua no cholesterol no 200 in fact 200 na make no kora no eno ne the HDL high density lipoprotein no and here 200 no but over the LDL now, the low density lipoprotein now, or here less than 200.
Every day.
Every day. Okay. Because we share the low density lipoprotein no, or no kawenya pa nka akosro no 130 or 140. Okay. What you say? Now, first, the high density lipoprotein no, now kono no 200.
Okay.
Good, and that is a good cholesterol.
Eja meba o se bia na o hwe yen na gofo na ye keka ne mudu amesrew on se we no apomudi ho asem nti na mpempi na ya na twi language a wo betumi di ahyehye no ya na esusu akakra nti mesrew te yase na mum no ye koyenim no ye bedi hu nkomo e ma watimi ate ase yie pa nti na ja ye nto aso
eti ube hu se a day bia no sa amount yi na wo se mrebo no otumi ye no de mani padua na chese mrebo no oye cholesterol no ewo impre no oyi the good cholesterol the HDL na we the bad cholesterol the LDL na te nye dwuma keto ano oye no na ni nyina so hia mani padua no for good functioning for hormones now obehwe no na ade a wodie no enu ankasa ma cholesterol now ni pedua ni hia no e ma no too much excess entina fi enye de mrebo no yesa wo ya ma on nkwane mu ankasa wo produce cholesterol bi a emfa yes so what you say fine what you fan say what sorry ene na wo de wadi fruit nko surely mrebo ne be ye nya 200 cholesterol ne dia ma na wakonya wo 130 no so eye LDL no so de ama wo na mom se ukodi meat na che se wanye careful a cholesterol no de be ma no be doso
okay
wo de hwade a day no was so 200 milligram deciliter of cholesterol
okay
nkosua ba ko ebe ma wo 185.6 185.6 milligram of cholesterol.
What 200?
We here 200. Na nkosua ba ko ama a friend saying 185.6 you know. Say na aka na wanya 200 no.
We dey emfa 0.6 no kran to nche. 185 no kran nya easy.
Let's aka 15 pe.
Aka 15.
Afi yen hwa de. Enkwan a wo ye a wo di nantwinam yes ankwan no. Mo nantwinam ketwa na wo di no. About 90% milligram deciliter of cholesterol.
90%.
90%.
Okay.
Beef, the tongue kwema ya man kwa ni edutwa mo no. Ketwa ba kwa de beka wa no about 85% deciliter of cholesterol.
85%.
And a duck, double. Ninam kakra no so be no. Ono so ma 84 milligram and 84% milligram deciliter of cholesterol. A ponchi about 75% milligram deciliter. Friends saying Odwan obedient sheep. About 97% milligram deciliter of cholesterol. And a lard about 97% milligram deciliter of cholesterol. And a chicken akoko about 88% milligram deciliter. And a pork friends say preko on the ultra 100.
Wow.
So eti won se oba bi wo oye nkwan ya se nkwan ne beye denti akoko kakra wom nantwie kakra wom preko kakra wom chese ansa na wako nsuomunam so de den egum
so meja de wo kaka yi na me calculate ye kra no ya bro 800 plus
yes
200 penny hu
yes de enti e mani paninya stroke no na ye ko eti ede na nka ohia 200 penny Saturday no cholesterol dey go ni pedre ni mu no aye more than 800.
Nti dey fan say wa fa nam mu kra mu miensa ko so pese won kwan mu yehwam kakra nti wa fa mu miensa kra na still now you are above that.
You are above. So what you say? Eti ube hu say sa cholesterol na abro so ni pedre ni mu se moja no koma ne pompi moja na se fe moja ne nam a friend saying intinim na ekwa se cholesterol no se aha eno obeduru a emoja no beduru a wabre a na waja cholesterol no bi egu ho
no wasan na chi
no wasan na chi o de moja ne cholesterol no kwa na se wo ha do bedu moja ne bre cause cholesterol no edoso a na waja bi egu ho no okọ eti ebe kakra eti ebeduru baby no na honum santi no na asi
moja na da ho
eti afi koma ne pompe moja na se moja ne ba beduru ho pe na wasan na che se ho no kwan na block it. So what you say?
It means say even time limiter and cause ntumi from ko do na se nsamra no. Now time ni so reduce.
Yes, one will say time as a time wa cholesterol ne build no o ma sign. Sign ni bi ni say hey, chale ada anansi acheme nai.
Okay.
Anansi acheme nai che say
ni
983. Eti sa time ni na no eye information brain system na chere say wanya careful a obekọ stroke obi tumi da be so na ne fa nyina na agene na wa company de ne ho be brobro mpasa sana wotumi asori brain system no ka cho say be ma wanya hweyi a oba wanya hweyi a be campaign o so what you say obi ho na chi etumi frizi just o tumi kra ngene ho obe prayer sana ne ho atumi esane no brain system na catch us the rate of cholesterol ne kon wa nya careful a obe campem stroke o ma prekope obon kaye wo ho bo se na honam no na peja asa de ho gigigigi na ejai ho tuwe te se
as ehome as a heartbeat no
that's right na ejai brain system na catch us moja ntumi mfamu free eti ni pedua me struggle Sabre na was say wo hwe na onye ndru a ebetumi asase mani pedwe ni madawo but to be hwe no nipa no man.
Okay, nti papa
no guso
sabre ni mu na nkaose wutumi dwane toa.
Sabre na so dwane to ayaresa bi a eben wo betumi aboa wo. So what you say? So oh my no nam no ye na ade. Fine. Eti cholesterol ne be koswa ebia 6 years or 10 years or 15 years. Kopim senti ni ba block kra. Eti a block kra wia. Let us say no. We do want to say woni atherosclerosis o. Wo hypertension. Eti one day what you want na wa no na sha se achia.
Wow.
Na twansuo. Ana be ho tiwa be se wo soro na fa say, "Hey, mo hwe me, hey, dia na akoyi me sane mo adududu." When your stroke na wi, just a moja nko. Eti the fact that when your stroke ni just a south side ho no ewu.
Wow.
Enye intini ade wo nya nya dai, enye adwuma. Say what you say. Aha. Now, so wo hwe strokes ya, me kirekire ya, egu ahodro. Yewo lacuna stroke. And that's lacuna ischemic stroke. When you stroke a free diabetes type 2 diabetic.
Obi all diabetes.
Obi all diabetic no type 2 diabetic no. Omno lacuna ischemic stroke.
Okay. And then the young called diabetes side.
Stroke ni one e one.
Okay.
And na say friends say hypertension and that's obi all hypertension is diabetic no. Etumi ko ho.
Okay.
Na o say you know, a stroke be affecting the deep brain. Now, a cutting blood flow, another blood supply, and oxygen to the deep brain, a cutting off. Deep brain, a more journey oxygen, alcohol, no mono, stroke, a cutting off. Nature has said, sa draining mono, a moja, any oxygen, and cohobi. But so what you say, it cut it off. Na eba ne sano a wo se nipa no benya adem so ho na ne ti epai no ne ti pai no na we be resulting to something we call microembolism from the heart or carotid arteries just a tia emoja no etumi fam what you say lacuna ischemic stroke stroke be a lack of blood flow to smaller arteries that supply deep brain structures.
Wow.
It is a entina edi moja ni mfrema kwadwe ni mu moja nko. Cholesterol broken. It's ya den na mami to me reduce kwan of so awenam. Odi nchene. Odi esichire. Why can't you reduce it? Papa ya no to me reduce it.
Pana na
so if you oba you another stroke I don't know cryptogenic stroke. This stroke no is a stroke there and no affecting two or more people a day. So what you say? Now it's a very very dangerous stroke. Good. And also no a stroke there a resistant blood from reaching the brain. That is the cerebrum, all the same. What you say? Now, may you first say, na see I say more.
Okay.
Stroke or bon kai. Then kai boni bini say, your friend no ischemic attack.
Okay.
Ischemic attack. Obi oba so oti wo no mo no na ne fa jojo. Hey, me to me ma me nsa so. Hey, me to me ma me nine so. By some minutes na one was also man nsa so.
No ni na kan kai bo no ho ana.
A stroke in kaibo. And a fan ischemic stroke. Or chira was say one nya hwe stroke no oba. No do beto form. Tis a one sorry and treaty. That's a final word in a sakawa. A one and a motor. Now, and you want ischemic stroke. This occurs when blood flow through the artery that supplies oxygen or rich blood oxygen to the brains becomes blocked. The blockage reduces the blood flow and oxygen to the brain, leading to damage or death of brain cells. That is adrenaline tea in crowd. What I say? Also, restoration depends on or upon how quickly. Restoration depends on or how quickly the person or besori acquire sabia aye betumi ahwe.
There is obi obedwane aye ne ho ntem.
So obi was stroke about first council ni o. Onye sika di nwuma soche ne stroke ni ba fe ya mfa nkwa sika ni o. Sika ni o so we aponche na mu wi odwan na. Wi nantwi na wodi nkosua kase e.
Ni bri sempa
o koshe si obi jira kase so nkosua no ma me miensa nchema me fa se burodonim na wase ayeti ni emu milk ani so wonnim aya impomuden ho asem a obi di sabos na oyebu hyehyw ma no se owo kwan na nipa esi so sa no
enuntina si ankofu nyindru 20 obi ni 20 30 32
no wa because of today didie and na oba the hemorrhagic stroke is also known as intercerebral hemorrhage or an ICH. An ICH occurs when the blood vessels to the brain rupture and blood accumulates in the tissue around the rupture. This puts pressure on the brain and causes a loss of blood to the surrounding areas. Hemorrhagic stroke is when blood from an artery begins bleeding into the brain. It's hemorrhagic no obi wa stroke no na adwen na intina wo se e di adwen intina wo se di moja ko adwen ni mu no a block entumi nko afi na sa intini ko afi na apai na moja nwini gu ni trim instead se wo sa kwa adwen ni mu no na nwini gu ni trim ni
ase pie o ta ya hyehye
na
ebi hye ase na
apai na enwini
what
iti moja ni nwini gu ni trim ni mu sa oda on to me na debia na ni timu hye no ase de ya som no boko ne hu zira no oje ne hu bi enje
papa we obi bi sa say ntia ntina se moja sone gu mitrim a empie mi hwenem
on say de nyankopon aye ne nuoma no enye sa na a friend say nipadua ne lineage no eko aha okay. So what you say? That's right.
Obi person who say bibisa ntia ansa ko na hospital.
Oh, but say ya me kan nyina no obedu ha. Ya center ha. Fa na say nyankopon ye wadom a ya boroso a na wotwemienu anamiensa no ya restore nipa na ebi. Ebi kwa ye di 72 hours 3 days to be restore ebi no.
Wow.
Yes. Because a mind baako onya stroke yi omo de chini ya obedu ha me 2 weeks ana me restore no ye wie kwa me ne ko gina a friend say ye centers ye ntum de kan ye hwe de obedi first ye yes ye ntum de kan onu kwa na di me kan
papa me nim say ya na u take records of so ne wa bi sa wo ho
yes we feed you on you the video na ko fondre
en hwe sa video nim na sisi a
daddy me adi me be pie o e pie ha no eni yare eye maestro.
Yo, my friend say.
But so me dindi Anthony.
It's down to me. What a heifer.
Me ti Teshi Bush Road. Yeah.
Teshi Bush Road.
That's all.
And come on, you be no TV so.
That's all.
I'm a crowd. You best answer about radio so I'm crowd waiting. Let's see permission say, how they are.
Honey.
Okay, me that's it.
On the 24th July.
Of this year.
Yeah.
Okay.
Asana adibachi 25th no. Me am coaching even in abuso kan eko pass. Ni nyina e bai. And we go down that 24th night asana adibachi 25th.
Okay.
Me sorry anopano na me sa aye dirty. Mu twemi. And then me wa machine kiti we bi wo ha ye di twin pressure.
Yeah.
Ya shami sama yeah since then me ho hwe me nine nyina aji Daddy, my young one. Nti saa Saturday no ekyere sɛ makafe mankɔ baabi abio Sunday the same thing nti ade kyima de no ɛna me sɔre yɛ beti ɛba de spill nkae wɔ kaso a nti media mo akyi kɔɛ nkura ɔmo ma me eduro ɛma me bɛ use yɛ but eduro no me use yɛ do metumi sɔre yɛ ɛnante but ahoɔden a yɛfrɛ ahoɔden a ɛbɛba me mu menyɛ bi because 1 year boy mpo bɛtumi apia me ato fam
wow
mapɛ me ho adura mesan kɔ ɛyɛ kɔ bisane sɛ sei na ɛyɛ me nti mahɔden no ɛwɔ fam paa nti mekɔ another place ɔmo yusu ɛme sɛ machine bi a wode hwɛ energy mo se me energy no from pa nti me yen window nti man hwe ya ko ba bi se ya na se me twa hwe a na wo ena me kan tram ti yo already no mati un ka di down but me nim say uye juma excuse me to say powerful say next to Jesus
what's me juma
powerful next to Jesus
okay
if I say meeting can menim say software trofo say
Okay.
Until we demand the chisa and I mean one day now we have program we war stroke a
Stroke career. Okay.
and I make be my sweet ye until me buy me buy no but to me it me some quite cheap.
Okay.
What did the man who said baby I did man dear and then it didn't make up baby. It me some buy and I made G true. Drew na G and less than 1 week no. As I'm doing a DK, Obi can't you say baby yamia. Over doubt. Hospital, me I won't name me. And now you won't name me, I'm free. The way I made in 90 pounds, say, hey, Papa, you want to say, I'm say, it's 90 years. Say, I can't and I'm a complete mouth.
Okay.
And also, we are going to ma, Daddy. I now want tea. Say, between me for me, Miaka, between me and me, one will say, Yammy. Because first, they mean to me cry.
Put me near phone.
Mean to me.
Ordinary phone.
Daddy.
Yes, yes.
You see, phone kitty where I cry saying, pass and me a batting back to say, Masuda.
Sir.
Masuda.
Okay, say the Asha a betia see ye. Me know be 2 weeks. Me I just want to be kind. Just a more dinner or 1 pound. Yeah, sorry. You could say go to the camera. Talk about to our chair. To say we should make kind of 2 years.
I'm not sure say we ate Mapa.
I see.
If you say, for the past 3 months, no, minimum idea I said America.
3 months.
The past 3 months, no, say, Rebecca said, me to America, come and say, Debbie, and I'm in 1910, Debbie.
It's a near many way to America. I'm a chauffeur, a chef. So, be when you stroke. What bad that sound area what you to make up.
Bitu Hano, Daddy, Mama, wonderful. Last, the Rempo beside me say, eh, me, and Pana, me to be 90 say. I make us say, I am. Say, I make us say, with me cop, Mokola, open a square, wow, I could draw a chin, and you share a diamond pen.
Baby, so it's Uba has said, by how long me, what how you do a hatchet.
Daddy, oh, Daddy. First one, we buy a room within 6 days.
6 days.
I feel okay. But, man, class will exactly say, it's another 3 weeks, and some.
Oh, okay. Just all by now, just 2 minutes.
And the other to me, somebody after that 3 weeks, and also 6 days, no. You'll be catching us and when you did. And now I'm meeting Hakasan. Now we were Opera Square. Now we did drop.
Okay.
Completely. Omo my supply. I'm checking the beer. I will
Oh, we are more.
Minye juma but ye tonyama me kotonyama.
Okay.
It me clients on what be tonyama. And yes, I mean just say.
Okay.
Yeah, I'm with toy.
All right.
And 1 year and I am here.
Let's see about champion. I shall for Openia minute kita hui ni di Eddie Anthony or Anthony, right?
News.
Now, or Yari a year stroke. Na stroke ni muno ana odeba and the radia do ya restore. Na numu na bibi sama na kosem sini obedru ha no ma nya kopo adom a ne ho atom. Eti saa dance ni mo na me se da bi se ne ho atom papa de a na ni na me ni be ya exercise ni ahwe betu bika. And no se na me ni no dimbika odi mika kwa chi mi no. It just say the ho ba ya de kra mo na tu bika twa me ho. Eti no ye besa nso akọ de akotu anko so. Me ka cho say Jaria mi Frimpong-Manson me to me sam and me we are see me da and massa so da. Aje obi a wawu na ye ne nsono e de free ne yam na onso na o ye pa na e do bra me dia se ye ho ati asi wo be so ma ye nkoto aso ne atie because obi yare stroke on the hospital that be just say yeah wo yeah no ya dane ne yes ye refuse e de pa na be catch some but so microphone ya say e be catch some before
me kan kire on say mo mra ha even po we po miss sorry free ha say e bi am nipa menu yes me de mo be free already ba ku bai ono so jini ya resa ya e say ma kan kire say papa tio ayare mi be so ni ndro no hwe no hwe obi ka kire say mi yare won ni just be bias kan won ko hwe bi na ga be sound yare no to finish ono so ba yare sawa
yo eti we hwe microphone na ne Ghana fo nkasa mame kire wo se ye yare yi awo a obedru ha de Nyankopon nam Dr. Frimpong-Manson me saso aye adiama wo sabre mu oni Ghana fo nkasa me yeti
and pray menu amani mema me papa ni mama mu ya no pray papa ye friend Mr. Frimpong-Manson sa o sa yare papa and family advert ana yare sanu endiagro enye sa wankasa agrobedi no one agrobedi who call different direction if you say onu nindro no it said assume to say next to Jesus or the come one if a pet if a direct you go can't say kotowe ansana ya yo debi onu nindro come number one if you say and then go me ba no na obi afre me be say hey my jindi say papa ne dro no juma be say madam who was come by there bra here ni last stop there is no place anymore ete mundi nechi mutini kan by there mundi nechi na on samu yare na mo wonton me nim se bet ya so ali biom esu Nyankopon wo soro no na nyame mi sum no na kram no ete mundi papa nechi na onu so on fa na eduru no enkamo na mo wonton e wo Yesu dine mu amen
Ashafo ni etiefo said ya mekacho openi ni friend of Mr. Anthony bema o we nyo ba no akasa e ma pa dance stroke the little form na on nantia onya ne ho je first week ye so ni mu na ho di begina said you can have no call as Accra
me call opera square
ko la ko nyina kokko diga ena ye na wo twe mienu ana miesa
you
mienu ana miesa
mienu
na wo twe mienu ni ode aba ye ha ye tu yare na se awie ade na ya wo ma mi stroke a che na wo papa ye enya stroke ana wankasa wadamfo ana wo neighbor senso ombra Shiloh Temple International oni adofo ewias bibi no ya te se yare ya jare di wo to form na wo sorry wo to form na wo nyo yare safo pants anso mu a wo kira ba wie no na de wo kọ asam na do enu ti na mesra wo say so what menka What's in medin? Dr. Joseph Frimpong-Manson. Bra. Na send ye any other money dia dance here. Won't be dia dance any.
Baby, wait to me and just stroke. And then within 2 weeks, or to me, Johnny say,
Yes.
oh, for me, oh, I want to cry, see me.
Oh, and no, oh, you see, and no, the secret or the difference in medicals.
Wow.
What you say?
If you have Yanni, son,
Yes, me sent here and me treating no. Me did not watch me. And me treating me treating me and I'm sad. That be me person me akasa me hwe sampa we gina na so be so gina na nti yen komrika ne yen hwe.
Wow.
Ti edi mrika de simu a ono we sam me ho. Let's say when you hold the crack anymore. Yes.
Habaima.
Yes.
Wow.
You see, brother, so what to me discover plants here? Oh, we are seeing a drobi anywhere a year faster than plants. All medicines were built out of plants, with the exception of few and say the chemicals on corn. It is an offer plant that's a raw, pure, and what in power.
It means to say, in Habaya, we in fitting for so there was so. But you mean,
I know that Bible casts a lack of knowledge, my people, they perish. Ubet me afraid any of these lines, you go screen as no, you better pick your call no, near more direction where to me aba. Week no, you said you must say no pa 8 by 5 near pong. Bra, man first stroke on into fee. Enko si da be na sa yare be da also. Bra wo ho beto. Thank you.
Papa ye dasi.
No, pressure ni nyina na say. Pressure ne say o moja no e bia deda. And na cholesterol so blocking in no. And na say you being lack of vitamin B12. Are you getting me?
Yeah.
It's in what na me as a medical doctor, my dream first and they say no. My man say met me and sa cholesterol no and that won't see me na intini mo kwane ya day and down. Afe emoja na ada no. Ma me nane ni nyina so ba adwen ni mu. Na afe emoja ne emfrema eye oxygen no etumi ndi afosane. Na se me nane emoja na me nane cholesterol na kire me sa afe the stroke na hypertension no way.
Wow. It means to say stroke can be cured.
Stroke is curable. And only papa na ye ni videos see ano.
Wow.
Once and one ton one ye di mrika. Wo de woman ba ko a onu so nya stroke. Obedrum ha onu de me use 72 hours, 3 days. Eno come say ndu 3 days no. And I'm a revival no and no sorry nante ye. Yi sa video na man for so hwe.
Mama, mama wa kwa ba. Mum pumu te say.
I remember how to say. One Thursday, we talk. It will not say, Mrs.
One Thursday.
Thursday,
Okay.
Mrs. Kasa, Mrs.
Okay.
I think I print and then this sister said, oh, Shemi. I'm just saying, Mrs. and Kasa don't I done it.
Okay. Who na who say? Oh, Thursday. Please, oh, Kasa, na what's this?
In the afternoon.
In the afternoon. Not said. No sure that's the day na yosa. Mami echichi. Ladies and gentlemen, or viewers, my mother here said that one Thursday she felt that she was seated. When she felt as though her body was turning or she was changing or she was deforming. Nampacho, any person say.
My sister, almost we can, one country.
So she quickly told her sister that she should look at her face. She told her sister to look at her face and tell her what was wrong with her because she couldn't tell. It looks like the whole body was deforming. Yes, I'm here.
Yes, I'm really sure. Like, you didn't wait. You see me, sorry, I forgot. Actually, to be 90.
So she was seated with the sister, and after some time, she even ate with the sister.
Yes.
And then she got up that she wanted to go and bath. But when she wanted to, as she tried to get up, she couldn't get up again. She realized that she was now bedridden. She remained in the chair.
And my sister saw, you know,
So her sister held her hand and then led her to the bathroom.
contrary, no one knew. Actually, sorry, number,
So she said after bathing, after washing, she went into the room to go and take her rest. But when she recovered, or when she got up, but when she got out of sleep, she realized that she couldn't lift her leg and her arm anymore.
The body was very heavy.
Her body had now become very heavy.
That happened. So I need to be my most proud.
So she couldn't get out of bed anymore. It's a whole no, na dear na yo.
Me too, I'm going to hear me. Get my sister. So then we are na. No, sir. No, I'm starting to be on catch up. No, sure.
So there she realized that she had stroke. Now, but when you have stroke, na a DNA symptoms brain, DNA deformation, DNA na about body. Yeah, she realized that she couldn't raise her leg, her hand, and then her face has changed. In fact, especially her tongue, her mouth too had bent. You will be actual.
Because seminar be workshop be. To me coco crime. But me gonna on testa. Me buy and no mama assist cry.
Okay, she's saying that in fact, one fine afternoon, she went to her house to go and say bye to her because she was attending a seminar. And on her way back, she decided to pass by to say hi, hello to her again. But when she got there, she realized that she had totally changed. What do you get here?
I asked her to send her to hospital. Because I'm in the hospital.
Okay.
Not you. Maybe by with your 14th, about 16th of this month.
Okay.
Me buy another day. There's a hospital. All of you will call. Until 17th, and I'm call on me. Mati, if anything. Me call and more say, oh, go hospital. Open her back. Now, to pay her back, dear, Mati, I suffer income or top TV.
Okay.
Until you will call.
Okay. In fact, on her return, she decided that she has to send her to the hospital. But my mama here said that no, she rather preferred to go to Herbal Center. So she said, okay, if you want to go to Herbal Center, I've heard of one doctor, so I will take you there. But you ain't here.
Thursday, to me. Me share na yanka san my brain to me. The corner is when Thursday night too late. It was around afternoon. Night too late. Then Friday anapa.
Okay.
Yebeba.
Yo.
And he said, "Edi buy ampa." Edi betu.
So in fact, they came here last Friday, just last Friday, and when they came, they met me, and I administered medicine on her. So we're going to ask how she was before she came, and now how she is. But as a time I'm buying, now what to say? As she said, when they came, she couldn't walk by herself. She was carried. But after administering medicine on you, to see it to say. How many days now?
3 days.
3 days. So I asked her when she came, and I administered medicine to her. How many days now? And she said it's just 3 days. So she was here last Friday, Saturday. Today is Sunday that she is testifying. So we're going to ask further, what and what couldn't she do when she was struck down by the stroke? And she's saying that she couldn't lift her left arm and the left leg. So let's see if now she can lift it or not. It's just 3 days. So you are saying it now. You can lift the leg. Be on your feet and let's see. Easy. Go. So now watch it. She couldn't stand on her feet. Now she is standing. Now she could lift the left leg. Now you can see she could walk. Just 3 days now. See what the Lord have done through his servant, Dr. Frimpong-Manson. Mama, sit down. So, Mama, you heard of me. When I was saying, and now the buyer. It's maybe say, dear now be catcher a chefoni tifua, obi or a doubting Thomas. Dear Otty, you who knows you was a winning dear. Dear now be catcher of my Ghana in California. But wait, look into the camera and speak to the viewers for us.
That's first of all, hospital. me see me the no ko or see on herbal. Then I had some feelings say oba you better. It's me cut train. Or they say yo. Me aka some me na me dey buy. Na me or na me who said Apostle Dr. Frimpong-Manson. Enye Boabayo. Ni haye pantuma. Enye obi nesi me say. Me ne ko obey me fie. Enti mi sorry na pa. Me knew everything. Kuna for. Me sorry I ma kwatena ye be bon komo sa. Na me say me mia yare a was your pay pa de. I didn't na me fa no ma Apostle Frimpong-Manson. Na eho na me Nyankopɔn asenso sɛ Nyankopɔn use Apostle Dr. Frimpong-Manson ɛde na ne nuru die project ne chemical herbal ankasa aduane kɛkɛ nti mumra amomeso hwɛ anafo yɛde me nua me maame me bibia aba 3 days back. Sorry.
Thank you. Mama, what would you say to Ghanaians that being down with stroke and then coming here and only 3 days reviving you back on your feet will lift you. Now can lift your leg and your hand, you are totally healed. So what will you want to say to Ghanaians who are listening to you? Maybe there is a sister, there is a friend, somebody somewhere who might also be encouraged by your words and also come for treatment. There may be something to say, Mama, dear Nabeka Ghana for ye tie na ye show sabri obi also should be a stroke did not to form or see baby anyway between your son and why you confused. If you grow to be called to a cigar, huge amount or Mahonta won, if you could give up a dinner by catcher sound of voice, I'll be Patricia camera now the Ghana for Casama.
They can't Ghana for so we are not getting or Dr. Frimpong-Manson. And you why your mammy no? I mean to make up, no mean to interest because why you be true Yami and I'm on at me a mammy. It's a brand a big year.
She's saying that she's saying that she's so happy and excited, thanking God for what God have done for her through me, Dr. Apostle Frimpong-Manson, and also encouraging you that whatever your situation, you should also come over and you meet your miracle.
The Atiana say, young clinic here, Manson Natural Therapeutic Herb Center.
Papa, where the Yadasi, Yama Musu Anessa, until Yadasi, chauffeur, Yabesre, Otina, Sesebria, Oshe, programming, who bet me as an Ashay in beam. Mr. Shayin, na shayin. No, and a bit me, I'm West Bibi. No more to 2 anamon, oh, Shayin, no, so antina fake and move to anamon. Yadasi,